AV Clinic and Diabetes Center. How to accurately measure visceral fat in clinical setting. CT scan, most accurate visceral fat measurement. MRI, radiation-free, precise visceral fat assessment. DEXA scan, reliable, accurate estimate with low radiation. BIA, quick and affordable, fast routine visceral fat estimation. Waist measurement, simple screening, easy indicator of visceral fat risk. Clinical alternative methods. DEXA, dual energy X-ray absorptiometry, low radiation, uses a very small dose of X-rays. High accuracy, reliably estimates visceral fat and body composition, measures fat distribution, differentiates fat, muscle, and bone mass. Fast and non-invasive, scan takes about 5 to 10 minutes with no pain. Ideal for clinical monitoring, useful for obesity, diabetes. Bioelectrical impedance analysis. Uses a safe, low-level electrical current. Test completed in just a few minutes. Measures visceral fat, muscle, and body water. Ideal for obesity and diabetes follow-up. Less precise than CT, MRI, or DEXA but suitable for clinical screening. Ultrasound. Radiation-free, uses sound waves for safe imaging. Non-invasive, painless and requires no injections. Estimates abdominal fat, measures visceral and subcutaneous fat thickness. Cost-effective, more affordable than CT or MRI. Operator-dependent, accuracy depends on the examiner's skill and equipment quality. Single-slice CT, at L4, L5. Gold standard reference, highly accurate assessment of visceral fat. L4, L5 level, measures fat at the 4/5 lumbar vertebrae. Quantifies visceral fat area, provides precise cross-sectional fat measurement. Strong metabolic correlation, closely linked to diabetes and cardiovascular risk. Limited routine use, radiation exposure and cost restrict regular screening. Visceral fat calculator, uses clinical measurements, calculates risk from waist circumference, height, BMI, age, and sex. Estimates visceral fat, predicts abdominal fat when imaging is unavailable. Identifies metabolic risk, helps assess diabetes and cardiovascular disease risk. Quick and low cost, easy to use in routine clinical practice. Screening tool only, does not replace CT, MRI, or DEXA for accurate measurement. Comparison of methods by clinical use. CT scan, highest accuracy, gold standard for measuring visceral fat. MRI, highly accurate and radiation-free, ideal for detailed assessment. DEXA, excellent balance of accuracy, safety, and clinical practicality. BIA, useful for routine screening and follow-up in outpatient settings. Visceral fat calculators, simple, low-cost tools for initial risk assessment. For more such details you can contact Dr. Deepak Katari, AV Clinic and Diabetes Center. Thank you.